We will get started. The topic today, of course, is maintaining brain health with age. We're so excited to share some key strategies with you to support cognitive function and just aging well and successfully. We know you're all excited about this topic because we took a poll a little while back and this was your number one choice. So we've invited Cindy Cashman to join us today, and we'll tell you a little bit more about her in a minute. Cindy, do you want to pop to the next slide? And we'll share a little bit about vintage fitness first. If you're not familiar with vintage fitness, we've been around since 2005, working solely with the mature adult, the older adult, in fitness and wellness and quality of life. So we're a mobile personal training company located in the Greater Toronto area. And we work with individuals 50 to 100 plus in their homes so that they can live independently and functionally well, continuing to do the things they want to do and the things they love to do with the people they want to do them with. We do work exclusively with seniors, and all of our trainers are specialized in this demographic. And we focus on results over time, so a consistent long-term relationship with movement and health. And I'm the owner of Vintage Fitness, and some of my stats are below there. I've been working in seniors fitness for 20 years full time, both group and one-on-one. And today I'm super excited to introduce Cindy to you. She's from an amazing organization that we've linked hands with recently called Qualicare Home Care. They've been around for a long time too and have different franchises throughout the Greater Toronto area. And I'm going to let Cindy tell you a little bit about Qualicare and about herself, and then she will take it away.
Thank you so much, Lee, and thank you to everyone for taking the time on this beautiful Monday to join. So I've myself have been a nurse for almost 20 years now. My specialty is critical care nursing, so nursing in the ICU, both at the bedside as well as being a clinical manager in an ICU setting. I'm very happy to be with Qualicare now in a new chapter of my career. So Qualicare is a home care agency, as Lee had mentioned. We're nurse oversought, so we build care plans for our families and our loved ones, and we essentially provide any type of care or service that they would require, whether that's assistance with ADLs, so toileting, bathing, hygiene, but also homemaking and linen changes, laundry, errand running, escorts to medical appointments. And we really just love to bring a personal approach to that care. And as I mentioned, so I build the care plans for our families, and we really ensure consistency amongst our care team so that our families are getting, a dedicated care team to provide their care. So very pleased to bring you this presentation on healthy aging as well as brain health, and super happy to partner with Lee. And so without further ado, we shall get started. Lee, just wondering if anyone else is waiting in the waiting room.
So far, so good. We've let everybody in. So I'll keep my eyes peeled for that and also for any questions in the chat for you.
Perfect.
So you're all set.
Amazing. And you stole my next sentence. So if there are any questions that that are posed, feel free to ask. Feel free to put them in the chat, whatever you're comfortable with. You can also email Lee and I afterwards too. Okay, so we are going to chat about normal brain aging, and we're also going to have a little focus on dementia as well. That's something that Qualicare really prides itself on, is the ability to really focus on dementia care with our families and our loved ones. And we really try to ensure that we provide some good memory care alongside the rest of the care that we provide. And so, with normal brain aging, there's slower recall, there's occasional forgetfulness, and this can present in the form of slower recall for names and words, occasional forgetfulness, like I had just mentioned, and some reduced multitasking ability. This is all completely normal. With dementia, however, it is persistent, it is worsening, and it does affect independence. So it's really memory loss that disrupts daily life, including some confusion, repeating questions, trouble with familiar tasks, and really just difficulty with judgment and with word recall. So on the next slide, I've just summarized some red flags to be, you know, cognizant of. So repeatedly asking the same questions or forgetting important dates or anniversaries or appointments, trouble following recipes that you're typically familiar with, trouble with managing finances, using household appliances such as, your microwave. We've got some language difficulties as well, such as word finding, um, poor judgment in the form of giving away large sums of money, unsafe driving, and lack of personal care is really one that we see initially that can become over time quite significant. And then, of course, withdrawal from social activities. So, avoiding conversations, familiar hobbies, and your friends, because potentially you might be finding that you're getting to be a little bit more forgetful. And so the social avoidance and the withdrawal does become a little bit more prevalent. And then of course personality and mood changes such as, irritability, suspicion, anxiety. So really maintaining brain health through lifestyle, early dementia detection, and compassionate response are vital, and we will chat about that. Okay. So there was a study done in 2024 that had addressed 14 lifestyle and health factors that could prevent dementia. Um, they say about 45%, but of course that's not for everybody and that's not cumulative. So every little thing that we can do does make a significant difference. So those 14 lifestyle and health factors were identified as having lower quality education in early life, hearing loss, high LDL cholesterol, or the bad cholesterol as we call it, depression, traumatic brain injury, physical inactivity, diabetes, smoking, high blood pressure, obesity, excessive alcohol use, social isolation, air pollution, and untreated vision loss. So we'll chat a little bit more about all of these factors in the next slide. Anybody have any questions thus far? Okay, perfect. Okay, so as I had mentioned, so the study showed two new risk factors. So risk factors such as high LDL cholesterol and untreated vision loss are important factors. Um, Hearing aids slowed decline in a major trial, and vaccines show to help the prevention of dementia. And there's been some new Alzheimer's drugs as well that have recently shown many benefits. So focusing on modifiable risk factors such as controlling blood pressure, managing diabetes, avoiding smoking, and maintaining social connections can reduce dementia risk. Um, we also touched on hearing and vision loss, so we'll chat a little bit more about that in the next slides. But really, this is just because the brain has to work harder to overcome the sensory, that occurs in our everyday life. And so by preventing that sensory overload, we're able to obviously decrease the risk factors involved there too. So our action plan. So in the next steps, we will review some ways in which we can reduce our risk of developing dementia or ultimately slowing the progress of an already developed disease potentially. And so vision and hearing, so very, very important. So getting your annual eye exams, updating your glasses, potentially considering cataract surgery if that's been something that's been diagnosed. Getting proper hearing tests and wearing hearing aids consistently is very, very important. So even my father, he forgets to wear his hearing aids or he refuses to wear his hearing aids because he's at the lake and wants to go swimming. But we find that he gets disengaged. So super important to remind our folks to, keep their hearing aids in, to make sure that their batteries are, tested and up to date and working properly. Because ultimately, like I said, better hearing, better vision increases social connection, and that ultimately protects the brain. So very important to do. So next, obviously, we're going to chat about blood pressure and blood sugar because there is a link between cardiovascular health and the brain health that we're chatting about today. So we want to aim for a healthy blood pressure, and that does look different with everybody. So I would encourage you to chat with your doctor about the parameters that work for you. The Sprint Mind study, I don't know if anybody is familiar with that study, but it showed that managing blood pressure more aggressively can help protect the brain, especially by lowering the risk of mild cognitive impairment. So this again just reinforces that heart health and brain health are very, very closely connected. So really the main takeaway is that good blood pressure control is one of the most evidence supported ways to reduce dementia risk, especially in midlife and later life. The intensive target, like I said, is not the same for everyone. So just please discuss with your doctor for your individualized plan. And then with blood sugar, so when blood sugar is high over time, it can affect the brain in several ways. So it can damage blood vessels, it can increase inflammation, it can contribute to insulin resistance and raise the risk of stroke. And so all of these things can, like I said, increase inflammation in the brain. That's something that we want to try to reduce, obviously, to limit or decrease the risk of dementia. So just in summary, so brain oxygenation, very important. A healthy heart and healthy blood vessels enhance oxygen flow to the brain, which ultimately supports cognitive function. And then the hypertensive management reduces the risk of vascular dementia and cognitive decline, and then the cholesterol management as well. So all very important factors with decreasing our risk of dementia. Now we will chat about diet. So diet is also very important. So Mediterranean or the Mind diet is a brain healthy eating pattern that encourages more vegetables, berries, whole grains, nuts, beans, fish, poultry, while also limiting red meat, butter, cheese, sweets, and fried foods. So it's really designed to support brain health and it can help reduce the risk of cognitive decline over time. So again, it's not about being perfect. It's just about eating in moderation. And, if there's foods that you really, really enjoy that are healthy and part of this diet, by all means, indulge in those. And obviously, just be careful with the things that aren't good, like those processed foods, those very, very sugary foods. But of course, we're all human and we all enjoy some decadent foods over here and there. So of course, just be mindful of this slide and the healthy foods that we can eat to maintain our brain health. All right, so this is Lee's expertise here. So I will hand this over to her so that she can chat about exercising and moving our body, which ultimately moves our mind. Go ahead, Lee.
Amazing. Thank you, Cindy, for all this information so far. We do have one question in the chat right now from Simon. Thank you for that. Simon's asking, can proper nutrition help in preventing dementia?
Absolutely. So all of these factors that we chat about can certainly assist with decreasing the risk of dementia. And if we do all of these things, then it ultimately does decrease that risk. But we just have to keep in mind that some people are predisposed. And so, of course, if you do see signs or symptoms in your own daily life, I would definitely recommend maybe chatting with your doctor about those, but also just explaining all of the great things that you do to help decrease the risk, like eating well and maintaining your blood pressure within range and exercising, as Lee is going to chat about.
Of course. Thank you, Cindy. And that doesn't mean that if anybody does get dementia that they did anything wrong, of course.
Absolutely.
As Cindy mentioned, that people can be predisposed. So we're just trying to show you how you can reduce the risk or slow the decline for yourself within your own framework, right? So that's just an important thing to mention. So thank you. I love talking about this topic, exercise in the brain. It's another compelling reason to move your body other than just being functionally well and feeling good in your body. It's also got amazing benefits for the brain, both short term and long term. So we're going to discuss some of those today. This could be basically a whole presentation in and of itself, and it often is, but I'm just going to give you some top line information. And then if you want more, again, we're going to give our emails at the end. We can share some studies, that kind of thing, because it's pretty amazing and compelling. So the World Health Organization recommends at least 150 minutes a week of moderate activity. I'm sure most of us know this already. This is moderate activity means exercises that get your heart rate up quite a bit. And it could be walking, swimming, cycling. There are many benefits to just getting your heart rate up on the regular. So that could be like half an hour, 5 days a week. And it doesn't have to be half an hour in a row. It could be 10 minutes here and there. But again, just shooting for moderate intensity, moderate for you. So if it feels like it's like at least a 6 or a 7 on a scale of 1 to 10 in terms of challenging for you, that's moderate. That's going to differ from person to person. Some people are going to have to run for that. Other people can hit around the block a couple of times, especially after a long winter, and that might get you going enough. Um, we are going to talk about strength training a little bit more and its specific benefits for the brain. And so we recommend adding strength training a minimum of 2 times per week, both for your brain and your body and your mental health. And obviously, we also recommend including balance, especially for the older adult, for falls prevention. We do stationary balance exercises with our clients, and we also do dynamic balance exercises. And often, especially with our clients with dementia, but most of our older adults anyway, we like to combine movement with coordination or games. Things like touching certain colors with your like right hand or your left hand, or even with your feet, balancing while you um, count backwards in fives, or while you're doing your sit to stands, doing some kind of cognitive task. So it's a way to kill a few birds with one stone. So basically, why are we talking about all this in the first place? We really want you to have a wonderful quality of life. So that's what it all comes down to. Like we're sharing these stats and these figures because we want you to get excited about what you can do to have a great life and age successfully. And we see that so many of you are already doing this, and we're very excited to see you continue on that path. So, successful aging to us means living well, not just longer. And research shows that maintaining physical health, cognitive function, and meaningful engagement, as Cindy mentioned, with the social activities with life can help older adults stay vibrant and independent. This is what we want. We all want this, right? One of the most powerful tools to support this kind of aging is exercise. And this can be regular physical activity or even better, a structured exercise program, and it plays a key role in promoting vitality, strength, and overall quality of life. So we want to live longer, but we want to live well if we're going to live longer. We want to be pain free in our bodies. We want to be able to have good cognitive function, um, a good general mood and outlook, and be able to achieve the things we want to achieve. So, um, just top line, what does physical activity do for the brain in general? A lot of things. And I'm going to share again just a little bit of information on each one. So, structure, a regular exercise program can actually grow new neurons and increase your brain volume. It leads to better outcomes of the brain, which brings us to function. So, those who are physically fit have more efficient brains, both during mental and physical tasks and at rest. The connections in the brain are stronger, the communication between the nerve cells in the brain. And so things like memory, processing, problem solving, that kind of thing are more effective. And Cindy highlighted the connection between the heart and the brain. And this is true. Healthy heart and vessels can help the brain health by increasing oxygen flow to the brain, which in and of itself also improves cognitive function. And so the benefits of being physically active are so compelling that even just for the brain alone, that we think you'll be moved to move even more. I'll share a couple of short-term and long-term benefits of exercise. And even if you latch on to a couple of these, I think it's pretty amazing what can happen. So in a single bout of exercise, your brain can be positively impacted. So first of all, some chemical changes happen in the brain when you work out, right? Most of the studies have been done on aerobic exercise, and we know that getting your heart rate up is an important part of this this benefit. But chemical changes occur in the brain. The body releases endorphins. Do we know what these can do?
Make us run
They
more.
can nice. They can relieve stress and they can relieve pain. So we like these guys. You can get what's called a runner's high from another hormone, which is epinephrine, and it actually makes running worthwhile. And dopamine is another chemical that can be released. It's it's good for motivation. So it's actually tough because it's hard to get motivated to do the thing, especially if you're not feeling well mentally or physically. But then once you do, you get rewarded with more of the motivation. So the trick is just getting started. We know that's the trick, right, guys? But we know you're on board. And then dopamine's again known as the feel good hormone, so it helps with pleasure, satisfaction as well. More short-term benefits, improved functioning, so focus, memory, planning after a single bout of exercise, they can be increased that you're functioning in those categories for up to 2 hours. So if you have something important on your plate, like Cindy and I today, we could schedule our workout within 2 hours before so that we can really concentrate on some of the details here today and use that to our benefit. Similarly, if you have a lot of anxiety, you could plan to do a mind body or a yoga session, a stretch session shortly before bed to release some of the stress and get some of those feel good hormones going before you wind down. And then this is a really good one too. So, in a single bout of exercise, which doesn't mean you're one and done, but it's just good to know, you can increase your positive emotions a lot, as you know. You can decrease negative ones, such as tension, stress, and anger, and that can last for up to a day. So, if you have someone in your life that is a little bit grumpy, you can tell them to go and do a workout with you, and then you'll see that the effects will last for 24 hours after, hopefully. Or if you're just grumpy, know that this exercise is not just for you, but for everyone around you, right? We're all grumpy sometimes. So, any questions so far before I go on to the long-term effects?
I don't see any in the chat, Lee.
Okay, awesome. We're all on board. I see some smiles. I think we're ready to move.
Awesome.
We're going to have an exercise session at the end. No, I'm just kidding. Um, All right. So some of the longer term benefits are very compelling as well. So this is more with regards to habitual exercise. And again, these can be in shorter bursts, but if you're shooting for most days, um, and you're physically active, this is these are some of the benefits you can receive. So strength training is actually one that can raise the brain-derived neurotrophic factor, BDNF, which is known as miracle growth for the brain. It's a protein that promotes neuron survival and growth. So it's needed to adapt, learn, and form new memories. So we can see how important this is for cognitive health over time and at any stage of the game, but especially as we age, as this would otherwise decline. Exercise is also amazing for regulating cortisol, which regulates metabolism and immune process. And if stress is a problem for you, this can help balance that out with regular physical activity. And finally, exercise is crucial in managing inflammation, along with the type of diet that Cindy was mentioning. Those two can be very, very effective in reducing inflammation in your body. Um, so how does this play out in terms of quality of life? Well, we've seen it with cognitive function, with mood, with pain, with the ability to move your body well. Um, And so it's actually amazing, but um, there's less decline of brain function if you're physically active, just as there's less decline of body function as it's connected. And even people that have been diagnosed with more major conditions, and we see clients with these conditions a lot, things like Parkinson's or other such diseases, diabetes, cancer, exercise can help after some of the treatments or after some of these diagnoses. And we can show you how and which ones will best suit you. There are also implications for mental health. Um, Exercise can actually help manage and prevent depression in some people. There are studies that show that it can be as effective as an antidepressant. It doesn't mean that you shouldn't take an antidepressant. It depends from person to person, but it can be used as part of the treatment, which is amazing, especially as it gets warm out, because it doesn't have to cost anything to move your body and to get your heart rate up and to get this medicine of moving your body. It can reduce the likelihood of getting another bout of depression if you've had one before. So that's amazing. And then research has also showed that moderate physical activity, like walking 5,000 to 7,500 steps per day, can actually significantly delay Alzheimer's related functional decline. Other studies show that exercise in young and middle adulthood, so if you're physically active in your 30s and your 40s, that you're less likely to develop dementia. And again, that doesn't mean that it's anybody's fault if you did. Um, and exercise later in life, if you start a structured exercise program as an older adult, you're still less likely to develop it. So it's pretty amazing that whenever you start, you can still either slow the decline or help yourself be less likely to be snowed in by the effects of cognitive decline and dementia. Pretty amazing. I think I just let
Great.
a couple more people in here.
And Lee, there is a question in the chat from
Oh,
Simon. He's asking if being involved in community volunteering activities can increase endorphins.
yeah, good question. And yes, yeah,
Whatever
it's
makes you
amazing.
feel good. Yeah,
Yeah, that's really good. I think Simon knows a lot of the answers already. We should get you on the next one.
we
Yeah,
should.
that's great. Um, and so it's awesome because with exercise too, you can actually achieve a lot of the things that we talked about. Like you can mitigate some of the risk factors, including the social connection, depending on how you exercise and where you exercise, right? You can do that with a buddy. I find that we're so much more likely to move if we sort of set up a schedule with a friend. Sometimes I'll trick myself into doing something by just saying, like, hey, Cindy, do you want to go for a walk at 2 p.m.? And then I know for sure I'm going to do it, you know? Otherwise, I can let myself get busy with something else. So, little trick
Or
for the trade.
my favorite is walking to the coffee shop.
Yeah, the
You get a little
best.
reward.
Yeah. And then you can like walk with a friend with your coffee, and then you're winning twice over.
Twice.
Yeah. Okay. And
Thank
then,
you for
of course, I'm going to invite you next time.
would love that.
Um, so yeah, this is really cool too. Types of exercise and the brain. And we get this question a lot, like which exercise should we be doing the most of? And of course, we always make it tough for you and answer the question like, oh, you should be doing all of them, which is kind of true. But most of the studies on brain health involve some aerobic and cardio exercise. So getting your heart rate elevated to a moderate level, as we talked about, is important. You can actually get your heart rate up quite a lot with strength training as well. And strength training, as I mentioned, also raises that BDNF more than the others. So it's good to know these things. Um, Balance and coordination can be integrated into some of the other exercises as well, especially if you've got creative trainers like we do over in our land at Vintage Fitness. Um, but we do recommend definitely strength training for other purposes as well, other than just for the brain, of course. Um, so there's one actually really cool study that I just wanted to share with you about strength training and the brain, which was a twin study with 324 healthy female twins in their middle age between 43 and 73 years old. It showed that leg power predicts healthy cognitive aging and global brain structure. Amazing, right? So if you have strength and power in your legs, you're much more likely to have things working in your brain as well. So adding interventions in midlife and beyond, like they were all between 43 and 73. And of course, it's never too late to start to target leg strength and power. So we recommend a multimodal approach to exercising. And then, of course, we also like to add cognitive challenges sometime as well.
Thank you.
So that
Thank
was a
you.
lot of info on why you should move your body. Do you have any questions for me on that before I hand it back over to Cindy?
How many squats a day?
Oh, good one. This is great. I think squats are the perfect thing to do in like little snacks. So what I ask people to try and remember to do is every time you get up out of your chair, just do like three more, like stand up sit downs. Obviously, unless you really have to go to the bathroom and then just go do that first. But like, say you're sitting down for lunch, you can just do five or six or seven sit to stands right then. And then, by the end of the day, you'll probably have a few dozen going. So, yeah, see where you can sneak in those exercise snacks. And then you don't have to do like 50 in a row, which is also fine. And sitting and standing is a great way to get the right form because then you're not worried about falling backwards. You have a chair there just in case. So it's a great little trick for making sure you're doing it right, protecting your knees. And then, of course, if you do lose your balance, you're also covered.
Make sure the brakes are on the walkers.
Yeah, that's a really good one too. If you have a walker, especially if you're using it to get up, make sure the brakes are on first and bring your head up first, and we can teach you all that kind of stuff.
Thank you so much, Lee. So after all that chat about exercise, I'm going to chat about sleep. So we're going to turn the page and chat about sleepiness. One thing that's very, very important and very connected to brain health is, I'm sure you've all heard of it, but the diagnosis of sleep apnea. So if you're finding that you're tired during the day, that you're getting, sleepy or falling asleep on the couch, of course, not if you mean to go down for a nap, but if you just happen to fall asleep, or you snore loudly at night, or your partner has to wake you up in the middle of the night because, you're waking the household up, please, please, I encourage you to get checked for sleep apnea. It's such an easy diagnosis to make. Connected with electrodes for a night in hospital. However, the results that you can get from that and the treatment that you can get is very, very important to brain health. So I encourage everybody, if you do snore at night or you find that you're restless and tired during the day, please bring that up to your physician and advocate for some testing of sleep apnea. So we're going to head right back into some healthy lifestyle habits. So as Lee had said, and this is again just a summary, so physical exercise benefits that Lee had mentioned, all those lovely endorphins and hormones that we can garner from exercising and moving our bodies are super, super important for healthy lifestyle. The balanced diet that I had chatted about a few moments ago is very, very important for supporting neural function and brain repair. And then, of course, adequate sleep rule. So we're going to make sure that we get enough sleep and healthy sleep to enable our brain to recover overnight so that we can maintain a healthy and overall, improved mental performance throughout the day. So as Lee had mentioned too, so several social benefits from, working out and staying engaged with our family and our friends. So we just want to make sure that we do get that social activity benefit, which again improves cognitive function. It supports our brain health. It decreases stress. And ultimately, managing stress does protect memory and it improves thinking. It improves, uh, your daily cognitive function. And we really just want to support that. We also want to ensure that we're not, isolating ourselves socially because that isolation and that chronic stress do harm memory over time. And obviously that affects our cognitive ability over time too. So just in summary, staying socially active, managing stress does support brain function. And isolation and chronic stress can negatively affect that memory and those thinking skills that we need to perform our best throughout the day. So some things that we can do. So some cognitive challenges. So engaging in things like Sudoku or puzzles, any type of brain games can stimulate cognitive function and mental agility. And that's really important because not only does it stimulate the brain, but it also, allows you to have the benefit of being with friends and being social. So as Lee had mentioned, going for a walk to get a coffee, those are all great things that we can do. Joining a bridge club or like I had mentioned, Sudoku are all just really, really great things to help stimulate brain, you know, vitality over time. Reading, so one of my personal favorites. So also just, enhances knowledge, but it also supports brain health over time too. So very important. And then learning new skills too. So it builds mental reserve. It can help delay cognitive decline. I know it's challenging to learn new skills as we grow older, but again, if it takes a little bit more time, it's so, so important and vital to do. So now that we've talked about several positive things that we can do, so I'm just gonna, change the topic of conversation a bit, and we're gonna chat about some things that can harm the brain. So, if you are a smoker, I would advise, like your family physician would, to decrease or even quit smoking if possible. Avoid heavy drinking, preventing head injury, of course. So making sure that we're safe in our home, that we wear helmets if we, undergo physical activity that does involve that, like biking. And just as a little aside, so in terms of, safety proofing our home and falls prevention, so these things are all very important. And one thing that Qualicare does do in our in-home free assessments when we meet with our families is I do like to conduct a safety assessment in the home. So looking at things like carpeting and rugs and tripping hazards. A big one here, especially in Toronto with downtown, where the homes are a little bit older, so the stairs won't be of even height. So it's really important to be cognizant of, those risk factors that might increase our falls risks. And so just wanted to, mention that a little bit. If there's things in your home that are unsafe, you might want to consider getting those checked out or fixed just to make sure that we don't have any increased risk of falls. And then, of course, reducing air pollution exposure wherever possible. Most of us live in Toronto, which is a very busy city, but just making sure that we can get some, fresh air if we're able to go walking in the trails and the forested areas that are in Toronto is great too. And again, tying into what Lee had mentioned, going out for walks is super, super important. And it definitely does, go towards increasing our both mental well-being, but also decreasing our risk of potentially those risk factors associated with dementia.
Cindy, we have an awesome question here in the
Oh,
chat here that I wanted to share with
sure.
everyone from Jenny. And she was asking, is line dancing considered a form of
Yes.
exercise? And boy, oh boy, yes, totally. And actually, a really great one for the brain as well, in particular, because of the bonus cognitive challenge of learning a new thing. Dancing is seen as one of the greatest things for your brain, even if it's not a formal, like line dancing, learning to dance type thing. So
Yeah.
by all means, put the tunes on and just move around and dance. It'll be
Well,
wonderful.
yeah, it hit on the topic that you had chatted about earlier is the coordination, the balance, the cardio. That's a perfect form of exercise, Jenny.
Oh my goodness. We have to set up a a line dancing class for everybody. That would be fun.
So walking for coffee and line dancing. Love
Yeah.
it.
Okay. We're doing it, Jenny.
So just a bit about the diagnosis of dementia specifically and when to get assessed. So as I had mentioned earlier, if memory changes are affecting your daily life, if you're getting lost or repeating questions, struggling with bills, like I said earlier, again, my slides are quite repetitive. I can assure you that I'm okay in terms of my mental health. However, we do want to just like highlight these things because they are quite important. A really big thing too is, of course, if there's concerns that are raised by your family or friends, that's very, very important to take seriously because they are around you all the time and they do, witness or see things that maybe you don't see in yourself. So again, the reason we stress about all of these things probably repeatedly is because the earlier that you do get assessed, the more options that you have, like treatment options, medication, different lifestyle factors that we can address to decrease your risk of the disease progressing even further. So definitely, if there's any concerns, definitely urge, that to get looked at. So what that includes, so comprehensive evaluation. So healthcare professionals will perform detailed assessments to ensure accurate diagnosis. They'll do cognitive testing. And again, what this evaluation and testing is like differs for everybody individually. There could be a little bit more rigorous testing for certain individuals, and then, some more clear-cut diagnoses for others. So it's really very, very personal. And then again, just reviewing your medical history can provide important context for diagnosis. Because as Lee had mentioned, we can do so many things to, improve our cognitive function. However, sometimes we just, it's predisposed. And so the little things that we can do obviously can help as much as possible. However, sometimes that diagnosis is predetermined. People just unfortunately do develop certain diseases like cancer, dementia, diabetes, etc. Um, so now just some key takeaways before we talk about some homework that we have had. Um, so just maintaining brain health is very crucial for aging well and for great quality of life. And, like I had just mentioned, detecting dementia early does allow for timely intervention, for better management. And of course, responding with empathy enhances care and it supports those affected by dementia. And again, taking all of these little proactive lifestyle steps does significantly improve our aging outcomes and allows us to, age gracefully and healthy. And so before I move on to the homework, I was just wondering if anybody had any additional questions that they might want to pose. Something in the chat. Okay. Alrighty. So Lee and I have put together a little action plan here.
Before you go on, I do have a question. It
Yeah.
looks like there's a lot of things popping up on the internet about check your cognitive health. And I don't know if those are scams or real, if they're useful, if there's something people should watch out for or people should involve themselves with.
Yeah, so you know what, I would urge you to chat with your GP in terms of what specifically, if you're having any concerns with your brain health. And then I think your GP would be able to guide you with some tests that they may feel would be important to potentially, leading the path forward. But I certainly would, like you had mentioned, like take very good caution and um, just tread lightly with those things on Facebook and the internet.
Yeah, and
Having this
AI
great
and such. Yeah, it's
exactly.
true. Yep, yeah. Your GP is
Yeah.
your best source for specifically what you need, because again, we're all individuals. There's another question here from Melissa. Thank you, Melissa. What would your advice be to seniors using AI to make their own exercise program? Such a good question. A lot of people are just putting questions into Chat GPT and such to make their own exercise programs. And Melissa also asked, how does Vintage Fitness implement AI in their work and business? Yeah, good question. So, Vintage Fitness doesn't use AI in our fitness programming whatsoever. We are person to person, me and you, go to your home, one to one, old school in terms of how we program for you specifically. Um, so I think to answer your question, Melissa, it's a little bit like Cindy's answer to Sid's question, which is sort of like it's got to be individual. You got to be seen by a professional in that arena.
Mhm.
We're the professionals in that arena with exercise and seniors fitness. So I would say probably don't put your questions into AI. Just give us a call instead. We can help you. Or we have tons of free videos on YouTube at Vintage Fitness. So we'll show you where to find all that after. We have another question from Mike. Oh, yes, yes.
Alzheimer's. Yeah.
Get advice from the Alzheimer's Society for the various forms of dementia. So that was not a question, but rather a helpful tip.
Hmm.
Very good,
Very
Mike.
helpful.
Thank you.
And just a little plug for the Alzheimer's Society is they're having a great walk in Downsview Park on Saturday. Um, so I hope to see some familiar faces there. We'll be there, and it'll be great. It's a lovely event. It's in Downsview Park. The loop is beautiful, and so yeah, I'm looking forward to hopefully seeing some faces there.
That sounds amazing. Yeah, and you can do something good for your own brain and body and other people's. One more question here. Do your trainers bring equipment to the home for sessions? Yes, we do. We basically confer with our clients to find out what equipment they have, if any, and we bring whatever they need that they don't have. Good question. Thank you.
Great. Great. Any other questions? Alrighty, so last slide. So here's the homework part that we bring to you, both Lee and I. So what we're urging you to do today is everything okay, Lee?
Yeah,
Okay.
everything's good.
Okay.
Yeah.
So I'm hopeful that in the next week or two, our lovely participants can book eye, hearing, potentially blood pressure and sugar checks. Blood pressure you can easily do at the Shoppers Drug Mart. And then Lee, I'm sure you want to mention the daily walks and balance practices. Is there anything else that we want to mention to our participants
Yeah.
on the exercise?
Just reminding you again that you don't have to do it all in one fell swoop. That a 10-minute
Yeah.
daily walk is a great thing to shoot for. It's nice if you can do it after a meal. You can get that immediate blood sugar benefit as well. And then it's also easier to remember to do if you stack it with something else. So, for example, the meal. And the balance practice can be done as a little snack size activity as well, like while you're waiting for the kettle to boil or something like that.
Great. And then in the next couple of weeks after that, the strength training sessions, um, you know, I don't know if you wanted to add anything to that, Lee, but feel free.
Yeah, we want to shoot for moderate strength training sessions as well. So, like in terms of difficulty level. So, just a thing to to note is that you want it to feel pretty challenging. Again, for you, it's going to be different for everyone. So if you haven't strength trained in a while, that means you could be using your body weight or bands or dumbbells. Um, or if you have been training for a while, you might need to up the weight or raise the number of repetitions for it to be challenging for you. So as long as it's challenging for you, you know you're getting strength benefits. So sometimes it feels really weird. People are like, this is really hard, so I can't do it. It's like, no, this is really hard. And that means that I'm gaining strength by doing it. So that's the positive reframe that I want you to take away. It's like, oh, if this is hard right now, that means I guess I only have one way to go up, you know? So you got this.
Perfect. And then joining a social activity as well. So very important, like we had mentioned, for brain health and cognitive function. And then, towards more into the summer, so improving sleep routines. So, putting away the smart devices, half an hour to an hour before bedtime, limiting lighting, and just really establishing that healthy sleep routine at the same time every night is very important. So no fluctuations in bedtime routine. So going to bed at, 8 p.m. one night versus 11 p.m. unless there's a hockey game, like the Montreal Canadiens. Um, so yeah, just trying to improve sleep routines as we head into the summer, and the longer days as well is super important. And then
Yeah, that's really good. I love the screens outside the bedroom thing too. I only recently started doing that, and it's actually made a really big difference to my sleep. I was surprised because I'm not looking at it in the middle of the night, but even just knowing that it's there must have affected me. So I just
mhm,
stick it in the kitchen now, and it's not the first thing I do in the morning then either, or before I go to bed. So there's some separation, and then sometimes I don't even choose it, which is pretty wonderful.
yeah, absolutely. And then yeah, chatting about the Mediterranean meals. So, like I said, summer's coming. Great time to try out those new recipes with the Mind diet in mind. It doesn't have to be 3 to 4 nights a week, but start small, see if you enjoy it, and then work towards better outcomes. And so, with this homework being said, I don't see any questions in the chat, but feel free to chime in if you do. Oh, I think I do have one here. Will questions submitted ahead of time be addressed before or at the end of the webinar? Great question. We can address those right at the end. Um, and so just to end the the webinar, so Mike had alluded to the Alzheimer's Society as being a great local resource. And Mike, you're right on task with that. It's the number one resource that we have here. So certainly I encourage everyone to head there if they have any questions. There's some great community centers as well, located both in North York, but also throughout the GTA. And the list is here for you to browse through, and we'll share this as well. But some really great resources throughout our community to help support any questions that you might have or concerns. And then lastly, just Lee and I's contact information if you do have questions that you have that you don't want to bring forward at this point in time or you think of later. We're more than happy to field any questions that you might have or direct you to the proper resource for that.
Absolutely. And you will get the replay sent to you, the replay link. So if you want to watch it again and again, you can. If you want to share it with someone who you think could benefit, we would absolutely love that. We also have tons of other old webinars on our website at vintagefitness.ca that you can go and check out and learn from. And as I mentioned, lots of free resources, both on our website and on our YouTube channel. We do have one more question here that was sent in ahead of time. Thanks for reminding us, Wanda, to look at those. And we have one from Wanda, actually. So this is actually a good one. I'm sure a lot of you can relate to this. I have a thought in my head to do something. I get distracted momentarily and I completely forgot what I set out to do. Anyone else? And I mean, that's why we're here today too. Um, she says she's 73 now, and this seems to be happening frequently, very frustrating. So, as Cindy mentioned, with all the different components of things that you can do, it is quite complex, but there are lots of different things that if you put them all together, they can start to make a difference in terms of your memory, in terms of your cognitive functioning in general. Is there anything that you would like to add to that, Cindy?
Absolutely. I think just having the insight into that is super important, and that in and of itself is quite impactful. So, you're recognizing that, and that's something that as a disease does progress in terms of a dementia diagnosis, it's something that people don't have, is that they have that lack of insight. So, I forget things all the time, and I'm sure Lee does, and most of the people on this call. And it is something normal. We're distracted. We've got a million things going on. And so this is all healthy. And we do need to give ourselves a bit of grace in terms of our forgetfulness. But if it's
Yeah.
not impacting your day-to-day life in the sense that you're, leaving your stove on and you're doing something completely different without being cognizant of that stove being on, then that might be something to consider. But all in all, the fact that there's insight there is great.
Yeah. And there was one other part to the question, which it seems like I can no longer multitask like I used to. I can totally relate to that as well. And then I just kind of do a positive reframe on that too, which is just like maybe that's a good thing. Like maybe to just focus on one thing at a time is such a blessing because we don't get to, as Cindy mentioned, so many things coming at us at once now, with advertising, with things, popping up on our phones, screens everywhere. Um, I think focusing on one thing at a time is actually really wonderful for creating more connections in the brain in a positive way and lighting up the right centers.
Yeah.
Reading a book, for goodness sake, and just focusing on that is a
Yeah.
good thing.
And
So,
Lee, I just thought of something as well. You brought something to my attention is so my son was recent. I have an 8-year-old son. He was recently diagnosed with ADHD. Um, and the pediatrician was saying that the amount of adults and children that are undiagnosed with ADHD or ADD is astronomical. And so there's that as well. I mean, there's different diagnoses, there's different um, you know, di symptoms, signs and symptoms is what I'm trying to say
yeah,
that
so,
can
so
fit
some
into
people can be
that. So,
neurodiverse and yeah, and so we're all
yeah,
a little bit different that way in terms of what we can take on. So
that's,
finding what really works for you is
yeah,
the key. Thank you so much for those questions. That's really helpful. And we have some more oh yeah,
Sprint Senior People's
yes, more
Resources. And
resources from Mike. Very helpful. North Toronto, we have Sprint Seniors People's Resources. Yeah, for day programs, exercise and Tai Chi. Yeah, so you can look up Sprint Senior People's Resources for group exercise programs, which is also great for the social. And Tai Chi is great for the mind, body, and for balance. We really want to get you moving however you want to get moving. And again, we're here to answer your questions at a later date if you think of what you came here to ask later. Yeah. So I want to thank Cindy for joining us today, Cindy Cashman. Thank you so much, Cindy, for sharing all your wonderful knowledge. We're getting some claps in the chat. And thank you so much, everyone, for showing up today and sharing your amazing questions. Simon says thank you to Lee and Cindy for the awesome sharing. It's so much our pleasure. Such an amazing and important topic. And it's so much fun to get together with you guys. We'll be doing another one with Vintage Fitness in a couple of months, and hopefully we'll get to do more with Cindy in the future as well. So thanks everyone for coming, and we'll send the replay, and we'll see you next time.
thank you so much, everyone. And thank you, Lee. And thank you, Vintage Fitness. It was great.
Thanks so much. Okay,
Thank
take
you.
care, everyone. Enjoy this beautiful day.